why is it that some people get patients and why is it that some don't? I am going to tell you guys a little bit of some things that you can do that will help you in this journey. Welcome again. My name is Doyin. I'm a psych nurse practitioner, and I am the founder of UBridge Health and also Rethink Life with Doyin. One of the reasons why we may not be able to get patients, right, is because sometimes our colleagues, they have a way through and they don't share that information. So on this platform, like I said, I will share every information that I have. I've been, very, very open, and I share, as you can see, when I comment, I always tell everybody whatever I know. There are people that have messaged me privately, and I give them a little insight of what can help. Right? The only change is when I say the change is when, let's say someone wants me to coach them one-to-one, that's the different story. So when you want to ask any question, I will give you that information. But one that I want you to guys to understand is that one of the biggest issue, and when I say one of the biggest thing is that most of us are opening practice the same way. That's the biggest issue there. We're all opening our practices, but we're opening it the same way. I'm going to give you some little things you guys probably never heard of. And you'll be very surprised when I tell you this thing. And this is why I keep saying some of these platforms are actually harming your business. They're harming the vision you have when it comes to how you want to open your practice. For example, most of us, when we want to open a business, we normally start with growth therapy. We start with headway, right? That's one of the ways most of us begin. Right? We want to open a practice, and these sites are very good. They are very good. I do have a solution. If they want to talk to me, I have a solution for that. And this is going to really break through the plateau, even when it comes to headway. I'm sure most of you have seen on headway, and the conversation is, I'm not getting any patients. I'm just not. Like, I'm on this platform, right? Somebody will say, oh, I have 60 patients from Headway. Another person is saying, oh, I don't have any patient. I'm not getting any patient. I'm not getting exposure. Same thing for Alma, right? And I'm not saying don't join this platform. Join them. But it has to do with the vision you have. If someone wants to open their practice and you just say, you know what? I just want to do this on the side. Please go ahead, join Alma, join Grow. Join, if they allow you, right? Join Alma, join Grow, join the little platforms, watch that video of 20 sites, join those things, okay? But remember, don't go ahead and spend too much money. The number one rule with the business, you don't want to lose money, okay? You want to spend the money systematically. Like, for example, I said in my last video that when I first started, I joined Alma. But at that time, it wasn't the right move because I just began. And yes, Alma will credential you. There's something I also talk about in my teaching. I talk about direct credentialing, indirect credentialing. There are two things. When it comes to opening your successful business, it's not just one thing. It's many things. Starting from your foundation, starting from the way you opened, starting from the website, it's like little tiny things. That's why I say, do you want your business to be an extension of your life, or do you want it to be your life? Most of the people that you probably know that did things in the past, it overwhelmed them. Thankfully, now we have some things in place. We have AI that can help us. Those people worked hard, and most of the time, they probably had a connection, maybe in the hospital. They were a real life office, right? And people walked in. Times have changed now. People want to use, I don't want to go see a doctor and sit there for hours. No, if I could just do this virtual, let's do this virtual. Let me go do my blood work and I'll see you soon. So thankfully, depending on how you want to open your practice, some people want to open the brick and mortar. Somebody else doesn't. And you have to make sure that your business is not just, taken care of now. COVID happened and we couldn't, right, go in person. You never know what could happen, right? We just had a whole breakdown of the internet. You don't know what's going to happen. Don't go ahead and restrict your business to just one thing. You want to be able to, I have both in person and I also have virtual. There's a reason why I do that. One thing that business has taught me is that even though you have one way that's working, always have another. If you have a computer, have an extra computer, okay? Because all of these little things matter. All of those little things matter when it comes to opening your successful business. Don't build your business around one person. You want your business to be if you could hire your mom and say, Mom, I want you to learn how to do that. Just quickly, help me out. You want them to be able to do it. Someone that is not even a professional in your field, you want to be able to train them, be moldable. So these are like little things. Now, when I talk about your location, right? For example, some people, they will have like, and I'm sure a lot of us have done it, right? Before we had a DEA, if you're working, people will go ahead and get a maybe physical location. One thing I tell people, like just like any business, location is paramount. You don't just want to grab any location. When it comes to how much you will get paid, it has to do with location. These are one of the things they look at. Okay, so, you want to make sure that, you have the right location for you and not just any location. If you know you want to do it on the side, you don't need to worry about that. If you want to do it on the side, you can go ahead and get your physical location and you'll be fine, right? You can get a live location and you don't have to go in there. That's fine. That's all beautiful. I'm going to break the bubble here. For example, Headway, right? I love Headway and I like them. And like I said, I have something that could help them to fix this issue. One of the biggest things people don't know about Headway, and I want to, when people say they get credentialed, I want you to take a look. How do patients find you? Right? You want to be found, right? But can you even find yourself? Like, and I'm not talking to anyone here. I'm just, being dramatic, for my show. You get the idea. But literally, right? But sincerely speaking, have we ever sat down to actually see how can I be found by my patients? Because the thing is, we're worried about not getting patients. A lot of people, we're worried about not getting patients. Some people, their problem is not getting patients. Some people, it's keeping patient. For example, if you're the one picking up the phone for your patients, how do you answer the call? And if it's not you, how is that person answering the call? Whether you're helping a patient or not, be kind. If that's one of your core values, be kind, be nice, be soft, when you pick up the phone, whether you help them or not. Even if they're not happy with everything, just check up on them. Those little things, you'll be surprised some patients will come back. Even if they have an argument with you, they're not happy with you, right? They will still come back. They'll remember. So just leave people with something to remember, okay? There's a way that I do my practice, right? I send like a little, like I used to literally send a letter and I used to sign it and I would send it to the patient. Welcoming them to my practice. So those little things, right? Patients will be the one. Patients are going to be the one to talk about you. They will talk about you to the whole world, okay? If they love you. And even if they don't, I know some people said, Google, is a good sign. If I'm a nasty provider, then it's a good sign. That's not a good sign. No, it's not. We're here to care for people's mind. We're to care for their brain, their mind, the way they feel. These people are not at the best, right? And we're not at the best some days too. So let's just keep that in mind. So, you want to, like your business should reflect your core values and on the positive, right? Not necessarily a bad core value, the ones that really makes you who you are. If you're very stern, right? You might, that's okay. If it's more of respect, then you might want to be that way. But there's a way you can talk to our, we can talk to our patients. We can show respect, but at the same time, they feel valued. Everyone wants to feel valued. I'm not saying we have to be soft and everything. I'm not saying we have to be all, or whatever comes our way. But some things, right, should be at the core of our practice. What about people that work for you? Are they a reflection of who you are? So everybody you hire, like there was one provider that I remember, I was like, there's one provider I used to, I was, before I transitioned, I was like in the process of transitioning into my own practice. And I remember she mentioned there was somebody that used to pick up the phone and the person, it was just their accent. Like I was in that room and patients were complaining. They were like, they were like, this person is so angry, is so this, is so that. But it wasn't the person's fault. That was just their accent. And they were like, but the other person that works in the office is so kind. Yeah. They were like, and because of that, people were like turned off from that practice. Like they lost a lot of patients because of that. And I learned from that. And I was like, oh, okay. And so when I brought on my person, I was like, okay, I don't know you, but I want to hear your voice. So say something, So that's very important. So those little things matter when it comes to opening your successful business. Even with Headway, go on the platform. Go on the insurance platform you're credentialed on. See how you show up. Call those numbers you see there and tell me if it's working or if it's not. That's just a little tip of the iceberg. If you're not getting patients, there's a reason why you're not getting patients. So as a result, you have to understand that's why Headway tells you where you're billing. There's a reason why they say we're billing. They're a billing company. So if you know you don't want to go with the hassle of those, the indirect credentialing, right? Headway, Alma, Goro. If you know you don't want to worry about, being directly credentialed with an insurance, then absolutely, there's nothing wrong with that, right? There's nothing wrong with that. But if you know that, hey, you know what? I have a bigger vision than this, then those little things can affect your business. Everybody has a different version, right? A description of what success looks like. Why? For me, I started with Headway and I loved it, but I realized, I like it, but I just like to know where my money is coming in and when it's going out. I just want to hold on to my money. I want to really just establish this idea of that's what I wanted for me. When I'm coaching people, I'm doing it. It's tailored to you. It's not like, Doyin once. No, it's not about how I did it. Right? I told somebody else, they were talking about, I use ICA. They don't like it. And I'm like, yeah, I get you. I see what you want. But ICA is not what you're looking for. Try Advanced MD, for example. It's not a, one size fit all. If someone is coaching you, they might give you those information, but you may want to do some research, right? I've done those mistakes. That's why I'm like, I coach too. But if you are going to any coach, they will give you the information. Now, sit down and really ask you, go through those questions. When it comes to credentialing, I see a lot of people on the credentialing site saying, 9%, 7%. Where? No, you don't. And you don't have to do percentage if you don't want to. People don't know that. You don't have to do percentage if you don't want to. And if the company is not okay with it, find one that will be okay with it. Build the life you want. Don't make it feel like you don't have an option. You do. When it comes to the credentialing, right? That's one. Go look at yourself and how do you show up. And also when you're credentialed by yourself, when you're directly credentialed, take a look and see how you show up. Trust me, you might be very surprised. I was very surprised. If you already have an established presence, right, with, maybe working in a hospital, you might not be necessarily surprised. But especially if you're a brand new grad like me when I started, you might be very surprised some things you might find. When you go to credentialing companies, I know people, they would charge you $100, $150. You can do it yourself. I've done some myself, right? But at the same time, I just knew for Medicaid is a little complicated. I wouldn't tell people to do that themselves. You might want to get someone to help you, coach you properly. So what I would say to anyone is, if you're working for a company, what you want to do is that you want to go on the insurance platform, right? And you're going to call this insurance and say, okay, I see the way I show up, number one. See the way you show up, because sometimes you could be doing telehealth and they don't put telehealth. Sometimes you're doing in person, they don't put that, because sometimes the credentialing company, they do it right. That's another thing. Sometimes they do it right, but unfortunately, it does not show up. Like, for example, I was put under anesthesiologist. I'm not an anesthesiologist, right? So these little things matter. Go back and look at how you show up. Very important. You might check your neighborhood and you might not find yourself. You'll be very surprised, right? So these are little things, and it's big things. This is why patients can't find us. And I stressed it on the videos that I made. There's a reason I stressed those. I was express list. I was telling you guys, you go on there, you find psychiatrist. When patients type a psychiatrist, they don't see no nurse practitioner there. They don't see us. There's a reason why I made that video, because I'm trying to spread light. It may not be for today, it'll be for tomorrow. But I'm trying to spread light. Just like there was COVID, somebody's going to sit down one day and watch the whole video because they're looking for providers. So I'm trying to spread light to the public. So, when you'll be surprised, you might find us on the behavioral nurse. That's why I say those things. Everything I've been sharing with you guys the reasons why we're not getting patients. That's why I said, we have to watch it and listen. Just watch that video. You will understand a little better. I was actually very, very sad when I saw that, One of the platforms they put my resume on there saying I'm looking for a collaborator. That was my description. Like, and most of us don't go back to look at those things. We don't go back to see what parts they put us under. And it's not easy. That's why I say your foundation is key. It's not easy to just pick up the phone and be like, hey, can you just change my address? No, it's a whole system. It's a whole process. Most of us, we open business and then we leave the business. We just leave it there. Know the reason why you're opening business. It's not, and it's like I said, some people, it's not opening the business, which I've already shared. It's how to keep the patient. And it looks very differently. And what I do is I help you discover, I help you determine who, like when I say it starts with you, and that's why I keep posting videos even about the Oprah situation that I posted and I spoke about. You have to know what you really want. Like you will see that internally for yourself. You have to know what you want, then you work towards it that way. All right. So it's different from I think I know, or because my friend opened, I want to go ahead and open the same thing. No, you can be working together and the two people may not work together. So you might say, oh, I want respect. Respect looks very different for each one, right? Somebody else might say, I want integrity. Well, what does that look like to you, right? Some people are very, it might not necessarily be that. So pay attention to those little things. When I do the niche situation, I help you discover what it is that you're naturally good at so that you can create a social media presence around that. And that is something that's going to make you stand out. It's going to make you stand out from the rest. Like my thing, I didn't discover what it was before, but now that I know how to, I help other people. In my practice, you want to go to school, you want to go to college, you're trying to figure out what you want to do with your life. I help them because I was once there. Like I thought I was supposed to be something else, but I'm not. So I wasn't supposed to be that. I could have excelled in that, but that's not what my life-driven purpose is. I see life a little different. I'm like, yeah, this whole thing they talk about in social media, I'm not about that. Like, that's not true, And it's all about breaking that barrier. That's one of the things, like Rethink Life came about that way, right? So, and also, then tagging along is the business portion. So I hope that was very helpful. Thank you, everyone. Thank you once again. Don't forget to subscribe. I have to do this for my show. Don't forget to subscribe. Thank you so much and follow me. Have a great night. Thank you. Bye.